Hello and welcome everyone. This is Humans of Pharma platform by Pharma State Academy, which is focusing on different pharma stories based on pharma career, one's pharma journey, current affairs, and book discussions. This is another inspirational pharma journey direct Dilse where we will be having heart-to-heart discussion with a pharma leader. So, pharma professionals, students, and everyone hearing me out, it is my pleasure to introduce you to a seasoned business strategist with over 35 years of experience in building brands in emerging markets and India. Our guest today has a proven track record of consistently delivering revenue and profits by crafting innovative solutions in field of branded generics. Mr. V Sankar Das. Continuing with Sir introduction as a master of branding, marketing, and field processes, Sir has leveraged his analytical and innovative approach to guide large teams across geographies and create a leadership pipeline. He has successfully launched and managed all the top 10 brands of Dr. Reddy portfolio and placed the gastroenterology and oral care portfolios in a leadership position. In his recent role as CEO and director of Curatio Healthcare Private Limited, Sankar Sir has accelerated the value of the business by an impressive 7 times and made it the most sought after asset for top organization in IPM. His talent management skills combined with analytical skills and strategic vision have been instrumental in driving business and achieving organizational goals. So, without further ado, let's welcome our guest today, a visionary leader and strategic thinker who has made a significant impact on the business world, an expert in brand building, revenue and profit delivery, and talent management. Please join me in welcoming Sankar Sir on behalf of Pharma State Academy team and Humans of Pharma platform. Thank you so much, sir, for joining us here today.
Hi, good morning, Shazia. It's also my pleasure to join this discussion, and I'm very happy that the way you are going to take this session forward, as well as many doyens in the industry whom you are taking, is certainly going to have a profound impact on those people, youngsters who want to build a great career in pharma.
Thank you so much, sir. So let's get this conversation started, shall we?
Yes, yes.
Yeah. So starting with the first one, if your pharma career were a book, what would be the title and why? And also, to whom would you attribute your success if you had to?
Okay. So it's a very interesting question. I have never thought about writing a book, but this is a trigger. But certainly I would love to keep a title. The title would go like this: when you love what you get. When you love what you get. That's how I would like to give the title. Because when you love what you get, the complete sentence would be, you will get something you have never imagined. And that is very significantly enriching, very significantly satisfying, and it will also be very rewarding. So that's why I would like to quote, and that's what is reflecting my career. And why I want to keep that title, that's your second part of the question, is that I have found that many colleagues or many young executives, they find it difficult to keep their attention, or let us say focus, on what they have to do in their current responsibilities. And always their expectation is, this is what has to happen for me at a later point of time. Okay, there is always a peer comparison, or these are all unwanted pressure, where what I am going to do and what are all the resources that I have within my reach, and how well I can do that. If they can focus on that, they start loving it. I think they are in for a great reward in the career. When I say reward, I'm not just talking about wealth, but I am talking about a very enriching career growth. That's what they will get. The point is that they should love what they are getting in their hand. That's what I did.
And to whom you would attribute your success to in this, if in the book you had to describe a chapter in the book
Yeah.
saying that okay, my success is just attributing to this person, this family member, this friend. So who would that be?
Okay. So this is slightly a larger question or answer which will be longer because it is not going to be one individual. So I would put it in this way. I will attribute this to the culture of a company like Dr. Reddy's Laboratories, which I have served close to about 24 years of my career. So I have grown there literally, and the culture there is very, very enabling, supportive for anybody to grow well. So as part of this Dr. Reddy's learning culture, look at the different type of people whom I could interact, and everyone had contributed for my career growth. To name a few, first it will start with Dr. Reddy himself, okay, who is no more, but there were multiple engagement session I have had personally with him in his cabin. So be it Dr. Reddy or be it Satish Reddy or Prasad, it is from the family. But other than that, it is because of the Dr. Reddy's culture. After till about my 10, 12 years of my career, I have never heard about self-development programs in pharma industry. You know, I started as a medical representative and it was more sales. But after moving into Dr. Reddy's, and I got exposed to the culture, the type of programs. And many of these mentors are people who are still in touch with me and they have contributed significantly for me. I will name a few. Okay, so many people among my colleagues, they say that I am a very creative person. And maybe that talent was lying inside. But there was one guru by name Bhupendra Sharma, who was part of a company called Yerevan Consulting. And that company actually focuses on triggering creativity for the people and putting a process for how one can. And creativity can be trained. Okay, it is not that somebody is born with creativity and others are not. Actually, restrictions gives a trigger for creativity. So this Bhupendra Sharma is the person with whom I have had very many meetings, including in my recent experience in Curatio. We have engaged him. He's the person who had actually set the pace for my creativity. Or I would like to talk about, there is one Sunil Unniguttan, okay, who is a person who had shaped my communication skills, interpersonal skills. So these are all the people who have contributed for me as an individual to develop. And for my success in the career, I would certainly attribute significant portion to the prescription audit services. Okay, I have interacted with the Professor Mitra as well as Mr. Sanjay Mitra, SMSRC, or Chinmay, or Professor Tarun Gupta. These are all the people who have certainly contributed from a career perspective for my growth. So this is in a nutshell. So how can I say that all these people are responsible for my career growth and success when I call it? So I would say that all these things had happened because I was part of a culture, which I will credit certainly a company like Dr. Reddy's, which enabled all these things. And that's why, you know, in your introduction, you said that all the top brands of Dr. Reddy's, no, some success you have attributed to me, but that has happened because the culture was very enabling.
Firstly, the insightful title earlier, and yes, a great recognition of those who supported you. Really nice. Moving right along, how has your personal philosophy influenced your approach to the pharma industry, and how it has it impacted your success and all?
Yeah, so I will link it to the title, When You Love What You Get. Shazia, it is like that. When I finished my graduation, I never thought I will become a medical representative or I will enter into pharma industry. So we need to have the context of the 80s, where certainly every youngster graduating out of the college will have the worry about a job. Getting a job itself was very challenging. And for me, I attended an interview at Cipla, and the first interview itself, it went through very successfully. And I was not knowing what is this job. But look at it, I didn't ask for it, but when it landed on my lap, and within first 2-3 weeks of my training, as well as one senior colleague taking me into the fields, okay, I started loving this aspect. First thing is I felt that I am at my own. Means I need not to show my face to somebody to put my signature on attendance register or something. And it is free flowing. This job gave me a lot of excitement and freedom. Even wearing a tie, it was giving me so much happiness, because till the college days I have never got used to even wearing a tie or shoes. So there is a significant amount of pride that came in. Okay, I should tell you one humorous anecdote. So you know that in the final year, all the classmates will discuss about okay, what you are going to do or what you will do. So even before my results are out, I became a medical representative. But one of my classmate, he said, "Arey, it is a salesman job here. Okay, you will not get a girl for marriage, and nobody will give you their daughter for marriage." It's all humor. Okay, so this is what he made a comment. But no, believe me, I could successfully sell my wedding ring to my wife. Okay, so in the sense that my father-in-law got impressed, everyone liked it. Okay, all that capabilities of how to open a conversation, how to communicate very comfortably, how do you engage with the other person, all those things had come, and I think that is because I loved the job. So that's how it had opened. And in my entire career, I would say that one role I was keenly looking forward, and even today I'll be very happy about that role, is brand manager role. But more than that, whatever changes that had happened to me in my career, be it a brand manager, area manager, or brand manager, because I shifted from sales to marketing, brand manager, and then marketing manager, then overall heading a P&L unit, then going international, okay, and then coming back as a strategy head. This entire change, and later CEO, this entire change that had happened, significant things had happened because each of the role, I loved it so much. Happened on its own. I went with the flow. Whatever that was coming in my way, I only focused on, in this role to be successful, what I have to do. So I have never oscillated that when I am doing this work, what is that others are doing and what will happen if I am there. All those things never disturbed me. Only on my task, how will I do it? Okay, and that is one of the reason how this philosophy of okay, you love what you get has actually helped me to reap significant benefits.
An impressive alignment of values and success, Sankar sir. Along with this, passion for the industry can take many forms, whether it be the desire to make positive impact on patient lives or a fascination with the science and innovation drive the field forward. What first you drew to this industry, and how has your motivation and drive evolved over time as you have navigated the challenges of the pharma world?
Okay, so I told you this job came to me just like that, without even knowing what it is. But I must admit that in my school days and student days, one of the dream that I was trying to imagine for myself is I will become a doctor. Okay, that was very clearly that was there in my mind. So after finishing the school finals, I actually, in my college, I chose the group which will take you through medical seat. So that's how I prepared myself. Okay, fortunately, today I am saying, or unfortunately, at that point of time, I didn't get a medical seat. Okay, but it never put me down. I looked at this opportunity that came on my way. and that's one of the reason why I loved this job. I realized that, okay, I didn't become a doctor, but here I am doing a work which is actually influencing the doctor and making him or her to do what I want him to do. Okay, this thought is a great motivation, Shazia. This thought that the doctor is listening to me and exactly following what I am telling him to do. Okay, so this success of me getting inside the chamber and generating prescriptions and the doctor listening to me. Okay, nowadays this job of a medical representative has become very tough in the sense that today doctors do not give that much of time. That is, the part of the blame is not just on doctors, but it is on the way people are trained and they are believing in their own grooming. But in the scenario where I was a medical representative, I think I thoroughly enjoyed the job and success came on the way. And the motivating reason is that I am not a doctor, but I am doing something which is having an impact on doctors. Okay, so at some point of time, okay, is it my influence will be only on the doctors in the territory in which I am working? So that's the time when I got this elevation as area manager. I realized that it is not just your 300 doctors, but it is 5 representatives and 1,500 doctors is what I am having an influence. That gave another kick. And then Dr. Reddy's called me to marketing, and actually in that time, Omaze or Enam, these are all the unheard brands. Okay, but I realized that through one brand, I am having an influence from Kashmir to Kanyakumari on thousands of doctors. Okay, so this motivation, some people say that what is this pharma marketing is repetitively boring. But for me, pharma marketing is repetitively an adrenaline and it keeps me very happy. So that thought that through one brand, I am influencing 50,000 doctors. Okay, and through multiple brands, one gastrointestinal brand, one cardiovascular brand, if you look at it, my influence is going across several specialties of doctors. Okay, through people, of course, but this gives significant amount of satisfaction. In a way, we can link it that it is, because you said about contributing something for the patients. I should tell you, okay, Omaze as a brand, if you take today, every day, not less than 10 million people are consuming Omaze. Okay. Now I believe in good karma. Okay. So anybody taking Omaze and living comfortably, devoid of acidity or anything, somewhere that fellow will eating a pani puri or bel puri, he will thank Omaze. And I am pretty sure that good karma will certainly get added to me if somebody is maintaining a registry. So you look at it, the more and more I grew in the industry, my influence on this childhood aspiration of becoming a doctor, that only had increased. I went to international also. So you can imagine today Omaze is the leader omeprazole brand across very many countries. Okay, so all these things, I am just quoting Omaze as an example. So like that, there are very many brands. So all these things, okay, you start thinking that, when you launch and sometimes, a certain out of box idea, what is a good product for an orthopedician? Okay, how do you actually take it to a dentist and make it as a religion to the dentist? Okay, very interesting challenge. But you take a brand like Keterol DT today. Keterol DT is a NSAID, but it is a religion not for orthopedician, not for physician, not for any surgeon. It is a religion for a dentist. Okay, so how one orthopedic Me Too NSAID product becomes a dentist religion, and how did we impact or influence that? Okay, that is the happiness and motivation I get. Okay, so that's now to put it in a nutshell. What is the motivation? Yes, certainly patient benefits, but my childhood dream of becoming a doctor, it gets thoroughly fulfilled through this type of brand building activity.
Thank you, Sankar sir. Oh, a great example of innovative problem solving, I guess. Our next question is waiting for us, but before that, just wanted to share a small clip which shows how your achievements have truly left a mark in the industry. And that would be reminded by a beautiful words spoken by Mr. G.V. Prasad, Managing Director at Dr. Reddy's, during the annual celebration event in 2011, where he praised your exceptional work in the pharma field. So, here with the clip.
And at this time, I want to talk a little bit about a colleague of ours who exemplifies the personal passion and individual growth that is possible at Dr. Reddy's. This is about a man who joined Dr. Reddy's in 1991 as a medical rep, full of passion and enthusiasm to make a difference. He was 20 years old at that time. For the first 2 years of his career in Dr. Reddy's, he worked around Coimbatore, and I hear that he was going around in a bicycle first, and later on he bought a bike, a motorcycle. And then, he fell so much in love with his job that he experimented in various fields. He joined marketing, he did stints in strategy and international with great success. He is credited with helping build some of the mega brands in Dr. Reddy's in India, Omes and Nice. He's also responsible for helping us build a major presence in Venezuela. And he made a huge difference to this company. And today, most important of all, today he's a vice president in our global generics business. He's none other than your colleague, Sankar Das. It's truly inspirational what he's achieved in his career at Dr. Reddy's. And what can we learn from his career? I think the 3 lessons. The first is, at Dr. Reddy's, there are no limits to growth. If you believe it, you can do it. That's the second one. And when you love your job, it certainly shows. So, Sankar Das' story could very well be your story. And why not?
Obviously, any words before I proceed to the question?
No, this memory is, there are very many exciting moments that I have got experience in company like Dr. Reddy's. Okay, this is one such memory. Okay, but you look at memories of how we have built certain brands and certain with the field force. Okay, for any marketing or a senior person, field force is the major talent, talent available, resource available, and they should be motivated well enough. Okay, I always call it like a mobile phone charging. From you charge them in one briefing session or one meeting session, and then it should last for 3-4 months, and then they come under the influence of customer rejection, competition doing differently than what we are doing. So the charge keeps on going down, and then you have to do it. So in this time, okay, how differently you are in a position to take your strategy and conversation. These are all the areas where in company like Dr. Reddy's, which provides the type of an environment, you will have a lot of excitement. I will tell you one brand launch, which was meant for relieving the issue of morning stiffness. Okay, in Dr. Reddy's, we conducted the briefing session, the training and briefing session, and it's a very exciting moment. So that's how many people are constantly in touch with me. We conducted the meeting early morning at 5 o'clock. We asked the people to come in their night suits. So all the people, you get up from the bed and come in from whichever hotel we are conducting the meeting. We asked the people to come in their night suits. And when they came in, okay, they were all given that morning coffee and tea and a newspaper. Okay, so people thought I'm talking about 15-20 years ago. Okay, so at that time, seeing news through phone and all were not there. It's that era. So we gave a newspaper, and to their surprise, when they opened the newspaper, it was entirely modeled like a regular newspaper, but it is called Arthritis Express. and how different doctors are seeing arthritis patients, no osteoarthritis, rheumatoid arthritis, everything about it written in a humorous way. And then we completed the session morning at 7 o'clock, 5 to 7. And then we took the entire team to the swimming pool and we all jumped. So you see fun and the theme, the understanding. The guy will never now go out and deviate from what is meant for a morning stiffness product. That guy will never do that. No, these are all the exciting moments, Shazia, I have had. So opening the sessions with a beautiful, these are all pre-event managers day. Today, for the last 15, 20 years, you have event managers coming and doing a lot of work in the pharma meetings. I am talking about a period where event managers were not there. The brand manager and marketing manager has to create very interesting events. So we have done all that. Okay, these are all very exciting moments. And when the field guys get charged and they come and tell you, that's the great moment as a leader one will have.
Okay, so moving on to the question, it is someone who is called good friend and highly positive person, finest marketing guru in the pharma industry, calm during difficult times, and many such appreciations. Frankly, this is what I have seen through your LinkedIn profile, and such amazing words for you come from the industry people. How did it feel?
I feel very good. I feel very happy. So I should tell you that any colleague who had been part of my team for more than 3 years, let us say, now each of that individual I can name, everyone had grown to great heights. Okay, so some of them are working in company like Dr. Reddy's, somebody outside Dr. Reddy's. But those people with whom I have worked, they all have grown to very significant heights. But I must tell you that I was not like that. Whatever comments you read, I was not like that. So I got shaped like that. Okay, so for that I should give credit to couple of organization-driven HR system. For example, as a leader, I had gone through 360-degree feedback system. At least in my 20 years with Dr. Reddy's, at least 4 times I have gone through. But each of these development sessions I have taken seriously. So every 2.5 years or 3 years, I used to get exposed to this 360-degree. And I have all the reports even today. I have this habit of archiving everything. So if I look at what was the feedback that was coming from me, from my team members, as well as the other stakeholders, what it was in 98 to what it was in 2010, okay, you will find that at a later part of the time, I became qualified for all these good comments. Otherwise, I too had my rough edges. People have given feedback that I need to be much more cooler. I need to give much more space for people. These are all part of the first feedback. But that had helped me and I worked on it very seriously. So over a period of time, the team members have started feeling so happy and comfortable about that. So I will say that this training and development session, which a company will organize for you, please don't take it lightly. Okay, ensure that whatever you go through, if you put to use, whatever insights you have got, you put to use, you will find a very rewarding experience coming across your way. That's how I will talk about it. So there are many people about whom I can quote and talk very happily. And what I did is, okay, taking their feedback and then developing on that. That's the answer.
Amazing advice, and more than that, impressive feedback and lasting impact by the colleagues and on the colleagues as well. With that, another question, Sankar sir, related to this only. Can you share with me a couple of team members who have left a lasting impression on you?
Oh, okay. So first I will talk about one sales leader. Okay. Because myself and this sales leader, his name is V.K. Chandrasekhar. Okay, in Dr. Reddy's at that point of time, okay, we too were considered like a railway track. Means how the train runs. So I was in marketing and he was in sales. But such an appreciative sales leadership, usually in many companies, sales and marketing is usually at the loggerheads. Whereas this VK Chandrasekharan is one such individual who will always look at maximizing, okay, whatever strategy we have evolved. In sales briefing sessions, it is a delight to watch how this sales leader is influencing and giving direction to the team in linkage with what marketing had wanted. So naturally, VK Chandrasekharan, in fact, he grew even faster than me in Dr. Reddy's. But it is such a delight to watch a sales leadership having a complete alignment with the marketing thoughts. So that's one person, successful person I will quote. But that is at a peer level. Among my team members, I would certainly quote about, and in general, before quoting about these members, I should tell that what helped in fostering the teamwork is because of certain books I have read in late 90s. I will quote this book. Gallup is an organization which continuously gives a lot of insights and books about successful management and successful managers. So their first book, which I read, was sometime in 98. The book is called First Break All the Rules. Okay, and this book is worth reading. I might have read this book, not the entire book repeatedly, but different sections in the last 20 years, at least about 78 times revisiting that book. This First Break All the Rules, as well as very many books, this Gallup as a company which has brought it. The theme of this book, to put it in a nutshell, is never tinker around an individual's weakness. Okay, spot the strength. Okay, and then work on the strength and maximize the strength. Now, this idea also coincides with my philosophy of love what you get. Okay, so I look at what is the strength. I don't bother much about the weakness of an individual and how to correct it. Okay, send that individual for development program to correct that weakness. I have never done that mistake in my career. On the other hand, okay, somebody is good at something, I might have sent that individual for certain sessions which will further enhance that capability. Maximize the strength is the principle I have followed. So some of the people, if you look at it, I will quote my colleague like Lakshmi Narasimhan, who was the key marketing person who took the gastroenterology portfolio of Dr. Reddy's to leadership position. Okay, in the period of between 2003 to 2010, if you look at it, Dr. Reddy's gastro portfolio became #1 in the Indian pharma industry. That's because I could see that her passion on working with the key opinion leaders and conducting through them certain large clinical trials. Okay, she was having that capability, and any doctor will be in a position to talk to her very comfortably one-on-one. So with her, we could do a significant work on the irritable bowel syndrome. And just one project with her in 5 to 6 years, because it's a huge project, but the portfolio became #1 in the country. So I would rate her. And what is good about her? Her passion and love for that gastroenterology and the way she works 24 hours, her brain was dominated by this thought. How will I take this therapy to leadership position? I'll talk about a colleague like Samish Menon, who is now in US, is one of the directors at Takeda. Very interesting individual. He was in sales with Janssen, marketing. At that time, Janssen was the only company, I think, marketing itraconazole, okay, and intravenous section. And this guy, salesman, he might have written at least about 6 or 7 letters in the non-internet era, wanting to become part of my team in brand management. Okay, and every time, okay, I used to read that letter and put it off. Okay, I have never even bothered about, even talking to him or calling him. These are all my own learning also. But one day when this cardiovascular congress was happening in Chennai, and this boy, Samish Menon, was in Chennai at that time. So I thought this guy is sending so many letters. So when I am attending this cardiovascular conference, one of the evening, why not I call him and talk to him? And in one evening, I called him. I was thoroughly impressed with Samish Menon, okay, about his curiosity. Curiosity is such an interesting part of an individual and very much required for a marketing person. So I brought him. I liked him so much, I brought him. And this is going to be his first experience of brand management. Gave him very unknown, very tiny brands in dermatology at that time. Dr. Reddy's was not big in dermatology. Actually, me, Samish and we all started dermatology in Dr. Reddy's. So I'm talking about the year 2000. You should see Samish Menon. He will see so many rejection among his colleagues. People will say, don't disturb me. People will tell him that, why are you coming repeatedly and pestering me? But never ever he had taken any, people cutting him off personally, but curious. Like the way he had worked to put foundation for dermatology in Dr. Reddy's, I have never seen another individual. So his single most strength was his curiosity. Now today he is in a great position at Takeda in US. Okay, so this is another individual. Even in my recent experience, I have several such colleagues. In Dr. Reddy's, Arvind Raja is there, MV MSA Raja. Okay, he is now international vice president in Dr. Reddy's. Okay, this individual, he met me in one ISG con in Hyderabad. Okay, and he said that I want to work with you, and we took him. Okay, he was working as a brand manager, and we took him. You look at him, the great growth he has seen. Now in Russia or all international generics market, he is the marketing head. So like that, there are very many people. Even in my recent experience, Shazia, I had one colleague by name Prem Sai. Okay, Prem Sai was actually brought into that company for taking calls from the end users. But I observed him from a distance about his passion in addressing that end user. So I thought that why this guy should be only sitting and doing that call of talking to the customers. Why not I pull him into the brand management? And in the few years he worked here, I think the heights that he has reached, okay, is phenomenally high, and he loves his job. So if you look at it, there are very many people who have been part of my team, and a good team working climate got established. That is because of the fundamental reason what I said is work on the strengths of the people. So they also feel happy. So my appraisal session also with them will not be on your weakness. My appraisal session is, this is the good you have done. What else you can do much better? Of course, I might have talked about certain weaknesses which had hindered the task in their hand. But other than that, you correct it is not my way of looking at it. I look at it how you can maximize your strength. That's how it had created many talents in the industry, and they feel happy about it.
So do we. And exactly the thing here, memorable team members made an impression. But surely, Sankar sir, this is how leaders like you see the world. So, with this, the other question related to this only, the team members and the lasting impressions, building and managing a high performing team is a critical component of success in the industry, not in pharma, but in every industry. Can you share a story of how you foster a culture of excellence within your team, and what unique tactics did you use to encourage your team to reach their full potential?
Okay. So I think part of the question I have answered in my previous thing. My strategy is okay, to look at what that individual is bringing to the table and look at that how it can be maximized. So many of the team members, their individual strengths get played around, and when it comes to taking decision, okay, I have completely empowered them. Okay, one of my very early boss, okay, by name another Chandrasekhar, no more, but he used to tell me that a boss authority is only to sign leave letter, okay, or increment letter. Other than that, okay, you should ensure that the people do their task on their own. Okay, and you are there to give your input, guidance, coaching. Okay, by the way, one of the I have listened to Mr. Hariram's session. So he mentions about one mentor, okay, who is no more, but no, he had worked with him in his formative period for no quite well. It was the same mentor who was also my mentor in Dr. Reddy's external. Okay, but he used to provide a service. His name, right now, no, we need not come into that. But C.S. Narayanan is his name. But these people have told me so strongly that if you have to do, don't jump yourself into the task. Ensure that the team takes ownership. So in any task, I have always considered that as a project management and made the people responsible for what they have to deliver, and whatever decision or whatever strategy they have, I completely give a listening to them and I encourage them. I do certain tinkering in terms of looking at what is the way the organization's practices are, or what are the set borders within which they have to operate. So those are all the things where I step in. For example, in my CEO role, if somebody is looking forward for, okay, I will ensure growth of this brand, and significantly provided if we give a scheme like this for this brand, then I will say a strict no. Okay, no brand can be sold through a scheme or discount. It has to be sold through conviction. So these are all the way I will intervene. But the moment they have the strategy which will fit into the right type of practices, after that, I don't sit on their neck, or I don't stand on their toes. It is totally left to them. I play a role only in reviewing and then duly recognizing. Okay, so one of the moment is I don't wait for annual appraisal time to recognize any good work that you see on the job. I talk about it. Outcomes are much later, but on the job you will see somebody doing a phenomenal work. At the time itself, I recognize. So these are all the tactics which has actually helped. Overall, at a frame level, I will talk about a broader principle that our portfolio should grow better than the market. So come with a plan which will ensure that our portfolio grows better than the market. Then apply the frames of what are all the limits within which they have to operate. Allow them to evolve their strategies, give a resource support to them, and then review. In most of the cases, it has been very successful, Shazia.
Wonderful, Sankar sir, and exceptional leadership tips and fostering of experience tips, surely. Progressing to the another question, in your opinion, what role do branding and marketing play in the success of pharma company? And how have you leveraged any of the strategies in your own career?
Okay. So first thing is there cannot be any business without marketing or brand building. Okay. If you have an excellent product without doing marketing or brand building, the consumer is not going to use it. You don't make a product only for you to consume. So any business, okay, without branding or marketing, it cannot imagine to serve the people. Let us come to financials later. If you have to serve the people, then it should have a medium of marketing so that the people understand what this product is. So for any business, it is very important. Now, how some of these principles you have used for your own career, that's a very interesting question. That a brand, if you look at Shazia, a brand means hundreds of things. It can do 100 things. Okay. But the role and responsibility of the brand manager is don't do all the 100 things. You cannot be everything to everyone. So how you narrow down your brand to just one or two identified aspects of that brand, and how you are being repetitive, how you are being consistent, how you are being continuous, that's what is going to give success. Now, I have used it in my career as well. Okay, if I look back, okay, I have not, now you know that I am a guy from college days. I have not mastered in mathematics, even though later part of time, the financials of P&L and all, I have started looking at it. But I was more a zoology student because I actually want to put off the mathematics in school days and come into zoology, what to go behind getting a doctor's seat. But if you look at it, okay, so what I have done is repeatedly, what is my strength? My strength is, okay, science. My strength is creativity. I told you about Bhupendra Sharma and all. My strength is creativity. So if you look at Dr. Reddy's, in any part, they would certainly even today comment that this was done by Sankar Das or this was. So the moment I got that feedback that people are recognizing me for my creativity, I repeatedly focused my effort on that becoming my identity. Okay, so it's like brand building. Similarly, how you take a product in a particular, what is meant for one particular section, how do you take it to another section? That's also creativity. So how those principles can be applied for. So whatever that has come to my mind, I said that every 3 years my career also changed. Okay, so it's a different domain. I have only focused there and excelled there. Whatever that came on my way. So this is the way I have leveraged certain brand building principles. And even now in my recent experience, it is the brand building principles, which I have used within my career itself, which has helped me to look at a very high valuation for the business I was handling.
Some valuable insights. Wonderful. So, I have taken a lot of your time, but this is my last question to you. Seriously. For young professionals looking to make their mark in the pharma industry, what advice would you give them?
Okay, so one is for young professionals and another one for management institutes. So if I miss it, you can remind me. First, for young professionals, okay, so it is very easy for us to look for yearly gratification in our career. Okay, so we always look for peer comparison of a big label company or what is that CTC that company is offering. These are all the way we are actually making an assessment of what is coming in. My advice or my suggestion to young professional is, have you ever thought about what is that a potential organization is doing in terms of developing their own people? In current social media era, it is not very difficult for you to get an understanding of internally how that organization is putting efforts in growing people. So put your learning at a much higher priority than your immediate gratification requirement. Okay. Let us imagine that when I joined Dr. Reddy's, its turnover was just 22 crores, Shazia. It was a small organization. Okay, and today it is a leader organization. I am part of that growth, but what was that advantage I have got it? As a brand manager, I was not restricted to the silo of only brand management. Anything that happens around the organization, I'll be playing a role because it's a small organization. How do you think that I will get more opportunities to interact with, let us say, Dr. Anji Reddy? Because whenever he was developing some molecule, how this will be taken to the market, to discuss that, he will call only the brand manager. So a young organization provides a beautiful level playing field where you go crisscross to different functions and then equip yourself. But I see many young talents, they look for a big label. Okay, if I am part of a big organization, we should understand there are also pros and cons of everything. So I am not coming to it, but in general, I would suggest that look at what you can learn in the first few years of your career instead of looking at CTC, the title. There is a significant amount of stigma or hesitancy for the management graduates in the college to take sales as a career. Okay, whereas it is the sales which has made me very successful, because sales is the function where you will actually see the customer responses. Sales is a function where in future your potential team is going to see customer responses. The way customer rejects your people, the way customer gets irritated or annoyed, or the way the customer gets delighted, everything you come to know only when you have sales experience. Unfortunately, when you try to recruit some people even for summer interns, some of these management graduates ask that we prefer to do desk research. Okay, now what is this desk research? These people will sit on an internet and whatever you want them to do, they will download it and make some project and present to you. Now, this is not going to take you anywhere. The industry is very large. Pharma industry is very big. So there is one role awaiting for every individual. So one will not go jobless. But certainly what you can reach as great heights, you will miss it if you think that doing a sales job is not my cup of tea. In fact, if you start in sales, you will certainly get significant rewards, faster growth, recognition, and great heights. Now, my second part, some of these issues, what I have quoted in my first part, also is driven by institutes. Okay, so the institute, just to put in bold letter, okay, to come to our institute for no placement, please understand our starting package is 8 lakhs or 10 lakhs. Now, they are actually depriving some great organization with good ideas, actually getting exposed to the institute, and let the youngsters decide of where they will shape their career. Now, it is many a times it is the institute which is also a trigger for gratification need of these youngsters. It is not, somewhere I remember this Jack Ma's address, Alibaba, Jack Ma's address to the management students. One should certainly visit that in YouTube. It is available, where he repeatedly says, your first 10 years of your career is nothing but learning. Okay, and Shazia, that has happened to me. Okay, till the year I crossed 38 years or 40 years, okay, I was just comfortable in managing that monthly budget. But huge bonanza and reward and recognition, everything came on my way after I crossed that 40 years. Okay, this is an industry which is waiting to, and it's a big industry, waiting to reward potential talents. Okay, do not fall a prey to early gratification, where 2 years, 3 years, you make a career move. These things are not going to help. The more and more, even if you are working in a large organization in a silo, okay, the more and more you go across to several other functions and get to know what is happening and get to know what the organization is doing, you will find it very difficult to grow in this industry. And there are tremendous amount of opportunity available for people who leverage whatever that is available around them, who leverage it. So don't get into silos, is my suggestion to the youngsters.
Seriously wonderful, Sankar sir, and a valuable source of inspiration to many. That too in very plain and effective words. Seriously, very effective. Um, so with that, we come to an end, and I wanted to thank you, Sankar sir, for your presence and for taking time out of your busy schedule. Thank you so much for being here. This is a treat to every pharma student, professional, and anyone who is required to have a change and more than that, motivation in their career. That is really a needed session. And everyone who is watching, I hope you enjoy this episode. Reach out if you have any suggestion for future episodes by connecting with us on LinkedIn and other social media channels at Humans of Pharma or email us at humansoffpharma@pharmastate.com. Bye and thank you.